Welcome back, everyone, to the Virtual Cafe Summer Series, where we are joined today with Julio Vo, a pelvic floor physiotherapist and a wonderful member and contributor to the Pole Physio team. Welcome, Julia.
Hey, thank you for having me.
Thank you for coming. I'm so happy we've pinned you down. You are a very busy woman. So I'm very, very happy and grateful to have you here today talking about pelvic floor health, particularly in relation to pole dancers and aerialists. Do you want to tell the pole and aerial community a little bit about yourself, perhaps, in terms of putting you on the spot right now? Everyone loves talking about themselves, don't they? Physios don't. Yeah, just a little bit about your journey to being the physio you are today?
Yeah, absolutely. So I started out in being a physio, I guess, working through the hospital system, and then started working at Joan Kerner, which was, I guess, a part of Western Health, where we specialise in women's health pelvic floor physio there. And then from then, I found my passion in pelvic floor physio. So I did my grad cert last year and no, 2 years ago and finished last year. And now I'm working at the Women's as a grade 2 pelvic floor physio.
Amazing. And the reason why I said you're busy is because you're not just working as a grade 2 at the Women's Hospital in Melbourne, you are also working as a
pole instructor.
Yes, pole divers, yes. And a pole physiotherapist as part of our team. So you wear many different hats within the pole and physio community. So yes, we're very lucky to have you on our team. So thank you very much for being an amazing member of Pole Physio team, and again for joining us today. So I kind of alluded, we'll be talking about pelvic floor, pelvic health, specifically today when it comes to pole dancing. So the pelvic floor, it's kind of one of those areas that a lot of people don't really know much about. I mean, they know where the pelvic floor is. They know parts of the pelvic floor, hopefully. Yeah. And keeping in mind today, most of the pole community is predominantly assigned female at birth. So we will be talking about anatomy, and I know you'll be talking about the anatomy mostly in regards to the female anatomy. But are you able to give us a little bit of a rundown of said anatomy of the pelvic floor and things that we need to maybe know as pole dancers?
Yeah, of course. So I've got a little trusty pelvis here ready to go.
To say that's such a pelvic floor physio thing to do, just randomly. Here's one I prepared earlier.
Okay, so well, this is, like you said, a female pelvis, but we can talk about the differences between a female and a male pelvis as well. So here you've got your pelvis, your two pelvic bones here, which join together at the pubic joint or pubic symphysis. And then underneath, you've got a whole bunch of muscles which attach from here all the way under. I'm just going to go upside down so you can see that it continues on and attaches to the coccyx bone there, or the tailbone. And so they are a set of muscles which we call your pelvic floor muscles. And you've got a couple of layers, or some say 2, some say 3. I'm just going to talk about them from outside. So you've got your outside muscles, which predominantly circle around the openings here. And then your inside muscles, I'm just going to flip it inside, if you can see sort of like this deeper layer here. Yeah, so that's your pelvic floor there, and we all have them. Inside, you've got your bladder, which sits at the front. Now, I don't have a bladder here. If you are a female assigned at birth, you've got a uterus that sits sort of in the middle, and then at the back, your bowels or your rectum. The difference between a female and a male pelvis is probably the reproduction system. So instead of having the uterus, you've got your prostate, and externally, instead of the vagina, you have your penis. Yeah.
And then in terms of, so the main role of the pelvic floor in all humans effectively is to provide support to. Yeah. I mean, my pelvic floor physio anatomy knowledge is maybe a little bit rustier compared to, hopefully compared to yours anyway. But certainly when I learned about pelvic floor, we were talking about it being almost like a sling, a support system to the organs there. And the main role is to act to lift and to engage, particularly during exercise. Am I right in still thinking that?
Yeah. So you've got your, I guess the support part of it is apart from all the ligaments and connective tissue that holds your organs that I just talked about inside the pelvis, you've got these muscles that sit or act like a floor to support it and give that extra support. It also acts to open and close the opening. So if you can see here, it sort of squeezes or tightens around the anus and tightens around the vagina opening and the urethral, which is where you wee. So it functions to hold in your wee and hold in your bowels or wind, but it also relaxes to allow you to empty. And then, like you said before, for dancers or pole dancers, it's, I guess, important in stability. So when you're doing, I guess, upside downs, inverts, anything that requires a little bit of stability through the trunk, you're needing to use your pelvis to assist with that stability as well. Other roles we probably don't know about as much as sexual function, so it's really important in arousal, in orgasm as well. And something else that's probably really important that people don't know is its ability to manage the pressure. So between your diaphragm and your pelvic floor, that's, I guess you can call it a canister. So you've got your top and your bottom, and then the front and back is your abs and your spine. And so in that area there, we call it your abdominal cavity, but that pressure changes consistently throughout your day. So it changes with a cough, with a sneeze, with a jump. And for dancers, it changes when we're going upside down. It changes when we're standing on one leg, all of those things. And so the pelvic floor really acts to, I guess, stabilize and manage that pressure. And when there is a dysfunction in that, you'll notice symptoms of pelvic floor dysfunctional issues, and when it's not able to manage that kind of pressure.
Amazing. It does so much, doesn't it?
Yeah.
I was going to say, so when we're inverting, for example, there is a lot of change of pressure happening there. So there's a significant increase in our intra-abdominal pressure. And so what you're saying there is our pelvic floor interacts with all the muscles of the abdominal wall and the lower back and the diaphragm to effectively stabilize that trunk section, provide it with support so that we can invert safely and effectively without causing any damage to our organs.
Yeah, pretty much.
Yeah, cool.
Continue.
You go.
No, I was just going to say, well, just talking about from a pole dancer perspective as well, you know, obviously when we're doing an invert, we're moving our legs as well. And so if you think about this pelvis, your hip bones literally are right here, and then your hip and pelvis muscles are just sort of sitting all around here. So they're quite closely connected. So you've got your, this is really interesting to me, but your deep external rotator muscles, which in dance allows you to turn out, or, you know, if you're externally rotating your hips. And the fascia connects to the pelvic floor muscles. So interestingly, we know that if you have hip issues, it can have an impact on the pelvic floor, or vice versa. If you have pelvic floor issues, it can have an impact on your ability to do those things as well. But yeah, I thought that was really interesting.
I find that really interesting as well. That's certainly, as a musc and sports physio, that's where a lot of my interaction with the pelvic floor comes from these days, particularly in relation to hip injuries. There's one particular muscle, obturator externus, which is a pelvic floor muscle, but also quite, like you said, a very important hip external rotator muscle. And so it has a dual role there. And it certainly can be a connective tissue that you know, is crux of many issues around the hip and pelvis. I don't want to sort of get too technical there. I'm trying to think, how do I keep this non-physio but still physio enough? And I think, yeah, I certainly in the fascia, like you mentioned, there's a lot of link connections around the hip and pelvis area. So yeah, it all works as a whole, and every part of our body plays a role. And I think the pelvic floor certainly plays a pretty incredible part. The other one is it works with the diaphragm as well. So if we're taking it back to pole, and probably specifically like inverts and going upside down, the diaphragm moves as we're breathing. What does the pelvic floor do?
So we know that the pelvic floor works in parallel with the diaphragm. So it means that when you're taking a breath in, the pelvic floor tends to relax and lengthen. And then when you're exhaling or breathing out, the pelvic floor contracts or recoils. So if you think about holding your breath, which is your breath in, it could have two different issues. It could lengthen the muscle and cause that pressure to be pushing down on the floor, which then could lead to weakness in the pelvic floor. And again, issues with the pelvic floor that we can sort of talk about later. But then if you then breath hold, but then overcompensate by squeezing everything or bracing your tummy, you can lead to overactivation of those muscles, which again can lead to other issues down the track as well.
Right. So to recap all of that so far, because we're like 10 minutes in and we've already covered so much information with the pelvic floor. Don't apologize.
So excited.
I love that. That's what I love about talking with pelvic floor physios is they get really excited. It's just the equivalent of getting really physio nerdy, but on one particular area, and I absolutely so the pelvic floor closes our sphincters, so it closes the openings, but also will help to relax it to allow for opening, so for relaxation, for emptying. It will help create that support around that pelvis hip area, which is important for dancers, so functional stability through the use of muscle contraction. It will help to supply support to the organs, so it gives them that little bit of suspension, that sling that we talked about. Sexual function, which you mentioned, so important from an arousal orgasm perspective. It helps to manage pressure when we're inverting, sneezing, coughing, and then it also controls breathing in parallel with the diaphragm. So have we missed anything there?
No, I think we covered it all.
Right. Pelvic floor does a lot.
It does a lot.
They're busy. Pelvic floor is very busy. Right, and so then we've chatted about anatomy of the pelvic floor and the key differences between a male pelvis and female pelvis, as well as the fact that it interacts with the hip and surrounding areas. So it really has a lot going on. If we start moving on to talking about how the pelvic floor can contribute to common issues, particularly in pole dance and aerialist, so issues that you would maybe not see at the hospital, so to speak, but if you're working in a local physio pelvic floor clinic, what sort of things would we expect to see that are common in pole dancers and aerialists as issues?
Probably the main things, I'll separate it into different organs just for us to understand it a little bit better. But the main thing from a bladder perspective is probably leakage. So you've got a couple of types of different leakage. Your stress urine incontinence, which everybody's probably well versed to. So, you're coughing and sneezing, any sort of increase in pressure in the tummy that causes you to leak. And then you've got your urgency. So when you have this sudden urge to go to the toilet, can't hold it, rushing to the toilet, sort of leaking on the way to the toilet. They're quite common. There are other things that you might notice as dancers, but maybe not as much. This can come with other issues, but not feeling like you're quite empty, so finishing your wee, standing up, and feeling like there's something left in there, or getting a little bit of dribble afterwards. And then other ones that can happen, I guess, with or without all of the things that I just talked about include frequency. So needing to go more than, every hour or two, or even less time, with less time in between. So normally every 2 to 4 hours is normal. And this is even when you're not drinking things that irritate the bladder, like coffee and tea and all of that stuff. So urinary frequency can be quite annoying, especially for dancers. Other things include, again, a feeling of an irritated bladder. So you're burning, stinging, urgency to go, but you've been cleared for infections, those symptoms, and even difficulty to start the wee, painful urination, all of those symptoms we often see in dancers. Can I continue, Sim? Have I spoken too much?
Let's stop there for the moment, because that's so that's all related to the bladder. And I should probably put a warning at the start of this video, is that if you didn't need to go to the toilet before, you will need to go whilst we're talking. We can confirm as physios, when you're learning about the pelvic floor, the cue to go to the toilet after a lecture on the pelvic floor, I remember this in uni, it was just like excessive. Everyone was like, we learned about the pelvic floor for 45 minutes, all we need to do now is go to wee.
Yeah.
A little bit of joke in there, but it's the truth. Right, so the pelvic floor controls all of that, and that's secondary to obviously bladder. Bladder is the thing that's producing the symptoms secondary to the pelvic floor input there. So yes, you can continue. So I think the next one you wanted to chat about was bowels.
Yeah. And we can go a little bit more brief. Apologies. I'm just getting
no, you can talk. That's fine.
And so bowels, similarly, like you saw before, there are muscles that circle around the opening of the anus. So you can have incontinence of the bowels or even wind, difficulty holding in your wind. Urgency, so again, no messaging that you need to go any earlier and not able to hold it, sort of needing to rush to the toilet straight away. Then you can get pain symptoms, so rectal pain, even lower back pain that improves once you open your bowels, or even pain when you're sitting, sort of between the space between your vagina and your anus, and that's called the perineum. Those things, those are signs of potentially a pelvic floor issue that we might need to look at. And then while I'm talking about pain, I might just go on to pain as well. We already talked about how closely related the hip muscles and the abdomen is to the pelvis. So sometimes you're getting tailbone pain that maybe is not specific to tailbone. It could be more your pelvic floor related. You can feel symptoms of pain during intercourse or difficulty inserting a tampon in. And like I said before, your rectal pain and sitting pain that we've already talked about. And then lastly, vaginal symptoms. So often, and this often happens postpartum, so more on your weakness type issue, is this patients sort of say they feel this pressure or feel like something's coming out, or a sense of heaviness that you notice. And that goes back to the function of the pelvic floor being able to support and suspend the organs. But yeah, those are your main symptoms that you'll see in clinic. Some of them may not be directly related to dancers, but pole dancers, aerialists, they're mums, they're pregnant, they're, I guess it's across the lifespan of a woman, you can have any of these symptoms.
Yeah. I was going to say, and the last one, the vaginal heaviness, that sensation of falling out, you said it's very common in postpartum population, and that's usually secondary to the weakness of those areas after giving birth. The other population is like a chronic cougher. Is that right?
Yes, correct. Yes. Yes. So that increase in pressure and inability to support with the pelvic floor.
Yeah, I was going to say, particularly in a time post-COVID where I know there's obviously in the last few years a lot of illness that's gone around, and a lot of people that have been struggling with coughing. That's certainly one that I've seen and picked up a few with my patients that have had to send off to then a women's health or pelvic floor physiotherapist to address those issues. So everything that you've just mentioned, like I said, may happen, may not happen. For some people, it sounds terrifying. For others, we're kind of just used to it. It's normal. It's like getting an injury, but it's an injury of your pelvic floor effectively. And all of it can be addressed through pelvic floor physiotherapy. Just the area of it, obviously, we're a little bit more sensitive about because, when we're talking about someone's genitals, they might not feel so comfortable with someone poking and prodding and looking around like what we would with like a knee or an ankle, for example. So seeing women's health or a pelvic floor physiotherapist is a brilliant way, because they will be able to help you address all those issues and be able to address it with sensitivity and with care that you need as a patient. Yeah.
And I think particularly, like you were saying, it's something that we don't really talk about. And, people are okay with having it during pregnancy or postpartum because it's so talked about. Like their doctors talk about it, everybody talks about it. But in, I guess, dancers or athletes, nobody really talks about it. It's such a taboo topic. Nobody wants to be telling you that, they're leaking and all of those things. So I think it's worth knowing that these symptoms can occur even if you're not pregnant or even if you're not postpartum. And I think it's worth seeing somebody because it definitely can be treated.
So I'm going to jump forward a little bit. only because I'm really passionate about this as a musc physio, not a women's health physio, but as a musc physio, is this one particular stat, which is that 1 in 3 women will experience some form of incontinence in their lifetime. So are you able to elaborate on the research around that, as to, you're looking at me like, gosh, Simone, you've jumped right ahead.
Yeah.
Do you want to give some context to why I've jumped ahead, maybe, and then we can explain the stat?
Yeah. I guess in terms of, do you want to talk about the study that?
Yeah.
Yeah.
About the research around it. Yeah.
So I think in 2018, they did a systematic review on, well, let's just go back. A lot of the research that is available at the moment looks at pre and post pregnancy women who experience leakage, chronic pelvic pain issues. That's pretty well researched at the moment. And then in the past 10 years or so, they started looking at, well, why are women who don't fit into these kind of populations, why are they leaking? And interestingly, in the last few years, there was a systematic review, I think in 2018, that found, I think, 1 in 3 athletes are leaking. So they say,
sorry, this is supposed to be the normal population. So this was the, like you're saying, so they've previously documented heaps on the postpartum and the pregnant population, the chronic pelvic pain population, prolapse population. So this is the population that are supposed to be normal functioning athletes that are experiencing leakage.
Yes, and then 1 in 3 were leaking. And so they found that female athletes are almost 3 times more likely to have urinary incontinence symptoms than sedentary women. And so I think the new research is looking into why, but I think that the different sports were high impact sports that they looked at. They didn't particularly look at dance or circus arts or pole dancing, but there were gymnastics, trampoline, volleyball, cheerleading. So lots of jumping type of sports where you're creating a lot more pressure throughout the day or throughout the game or the event, which is impacting the pelvic floor.
Yeah. I was going to say, and we can chat about the implications for this for pole and aerial students in a second. But to bring it back, I think probably best to explain, because I did jump the gun a little bit, probably best to explain why people would be experiencing incontinence in an athletic or a normal population. So what are the causes for that?
Yeah. So most people think it's just weakness, and that's not wrong. You can get weakness from a nerve injury. So if you've fallen from your sport, or even just postpartum from delivering a baby through the vagina. It could be from overuse or overload, like we were talking about, just this constant jumping pressure, constant, I guess, pressure, abdominal pressure, or inability to coordinate pelvic floor with whatever activity you're doing, or even just trauma to the area can lead to weakness. That's the one. The other thing you can have is poor coordination, muscle tightness, muscle spasm, increased activity in the muscles. And it can often occur as a response to overuse or overload. So you can either overuse it and it become weaker, or you overuse it and it just constantly contracts and it's not able to relax, and that can lead to some of the symptoms. Persistent physical or psychosocial stress, and we know that there's such a huge connection between your stress anxiety and how you're feeling mentally, because it affects your breathing, it affects a whole other lot of things, and that can impact your ability to relax that muscle. So I always sort of explain to my patients, really, really simply, the pelvic floor needs to function optimally. If it sort of sits in this suboptimal range where it's spasming or it's on all the time, it's not able to fully relax, and it's not actually able to contract when it needs to. That's probably the main things. And then other things like stress, I said already stress, sorry, trauma, compensation. If you have injuries to your lower back, to your hip, we said before that it's really closely connected. So if we know that the body's amazing, if you want to lift your leg up, it's going to get it up one way or another. It's going to use whatever muscles that it can to do that. And so often it can be as a result of having like a persistent back injury or back pain or hip injury. And then the other thing is other conditions like hypermobility or EDS, where the muscles need to work really, really hard to be able to function at that length. But yeah, those are the main things that we know can have an impact on the pelvic floor.
And then in turn would lead to leakage. So we can effectively categorize the things that would cause leakage into one of three categories, usually two of the ones that are talked about the most. So weakness, muscle tightness or overactivity, and then poor coordination between all the muscles. So they're working, they maybe have the strength, but there's something that's not quite right between the brain to muscle connection. So the firing patterns or how they're actually supposed to be utilized isn't really happening.
I kind of usually just explain it. It's like, if you're coughing, you should be able to contract before you cough. But if you're coughing and you can't squeeze it when you're telling it to, there's a lack of coordination there that's then going to cause you to leak. But then technically you're quite strong. Yeah.
So I would, as a musculoskeletal physio, I refer to that as power. But yeah, absolutely. Like it's 100%, it's coordination and timing of it all. So, but yeah, I think that's a really nice way to sort of explain it. So they're the three reasons why someone who is considered athletic population or normal population. So obviously I'm saying these in quotation marks because we as pole dancers are a part of the normal population, but we're a little bit abnormal in many ways, and what we're doing is an extreme sport. But yes, so we are classified under this study that they've done in the athletic population when they've compared to sedentary women. So we now know that we're almost 3 times more likely as athletic individuals and athletic females, in this study, to present with urinary incontinence symptoms compared to sedentary women, which is really concerning. So that's and we've also said that 1 in 3 women effectively state 1 in 3 women effectively experience incontinence at some point in their life. So it's quite considerable. And the study that you're referring to, yes, they did do a whole bunch of research in non-impact athletes and then impact athletes. And they definitely found that those who did a lot more jumping in their sport, so like gymnastics, lots of landings, they had a significantly higher risk of incontinence. And I believe also the weightlifters as well had a higher percentage as well. So from my perspective, I look at that study and I go, well, we're not, quite often as pole dancers, we're not doing lots and lots of impact compared to gymnastics, but there's definitely impact within our sport. So we do flips from the pole, we do jumps. When we're dancing, we can, land really explosively into splits. That's impact. That classifies as impact, right? And then in terms of weightlifting, we're not effectively weightlifting a barbell, but we're weightlifting our body weight so many times over and over and over again on the pole. So whilst they haven't done any studies specifically in incontinence and pole dancers, although there are some coming, and I do know about that, eventually we're getting there, there are definitely implications that this study has that we can infer information from that then relates. Sorry, I just went on a little bit of a rant, but did you want to give your opinions on this? What do you think the implications are from all the research and what we know and what you know as a pelvic floor physiotherapist? What do you think the implications are from a pole and aerial perspective?
For our students?
For instructors as well, I guess. They're not immune, they're not bulletproof just because they're an instructor.
Not immune. I guess like Sim was saying, we know that the sport places quite a high demand on our body as a whole. We know that there is an increase in requirement to stabilize the trunk and the pelvis through whatever we do on the pole. And like I said before, the pelvic floor plays a huge role in managing or stabilizing the pelvis. And so there is that huge connection that we know. So if you're noticing, well, firstly, let's start off with, if you're noticing any symptoms, it's important to go speak to somebody or seek professional help. It can be a pelvic floor physio. You can start off with your doctor and getting appropriate referrals if you don't know where to go, or speak to your MuskPhysio because they probably have connections with other pelvic floor physios. I think that's important. I think now about any potential hip conditions, lower back conditions that you might have that you feel is potentially related to any of your pelvic floor symptoms, I think it's worth telling your musk physio, because sometimes you don't talk about that stuff. They don't ask you about that stuff, because that might just be a bit of a breakthrough through your treatment. Either they refer you on, or they know that might be the cause, or it could impact your treatment. I think most important thing that I sort of took out was your breathing. So, you know, I find that when I'm teaching students and they're doing really hard things, they hold their breath and they brace, and that it's okay once or twice. It's just you're constantly doing that throughout, you know, however many training sessions you do throughout the week. That has an effect on your pelvic floor. So it's really important that you do take your time to do things slowly and making sure that you're breathing through it. Yeah. And then I think for all of us in this, you know, very go society, just working on our stress management and coping strategies as a whole person, because we know that stress and anxiety has an impact on the pelvic floor as well.
Huge. Going back to the breathing one, so because I'm sure there'll be a few questions, people listening at home wanting to know a bit more. So we already spoke about the pelvic floor works in parallel with the diaphragm during exercise, and I mean just during life in general, but particularly with heavier loads. Why, when we brace, so when we are doing something on the pole and we're trying to brace through our abs and through our pelvic floor, what does this actually do to the pelvic floor? But for anyone who doesn't know what we mean by bracing, it's kind of like that, making everything really hard, like so you're tightening up your abs so that I could punch you in the stomach and it doesn't hurt, that sort of sensation. What does it do to the pelvic floor, and why would this be an issue in the long term?
Yeah. Remember I said the abdominal cavity is like a pressure. So canister, sorry. So you've got the top, which is the diaphragm, the bottom, which is the pelvic floor, and inside you've got this changing pressure. And so at the front, you've got your abs, right? And at the back, your spine. So if you are bracing and you're sucking in your tummy, that increases the pressure inside your tummy. So it could be two things. It could be the pressure that's pushing down on your pelvic floor that can make the pelvic floor weaker. So this constant pressure. Or if you're over bracing and you're squeezing your pelvic floor while you're bracing your tummy, it can create this overactive pattern. So excessive tension that then has difficulty to relax later.
And people would think that overactivity means that it would just hold the pelvic floor up and it would be really good, but overactivity isn't great in the pelvic floor because it means it's ineffective at contracting as a muscle, which means you then experience leakage as a result, because it's like the muscle just doesn't know how to function normally. Okay, so ideally and like you said at the start, when we're learning a move for the first time, quite often we're bracing and it's just a habit or it's just like an ingrained, like I need to use so much more ab strength to do this. And then the idea is to get yourself out of these behaviors as quick as possible. So whilst your students or you as an individual may be utilizing that bracing technique initially, the goal is to bring yourself out of it as quickly as possible. There are definitely other implications as well from a pole and aerial point of view. So what about for the instructors out there? What do they need to be really aware of, other than like their students bracing with their breathing? What other things should they be aware of?
High impact things. So in warm-ups, often in pole dancing, we don't really need to do, you know, jumping star jumps or like burpees or anything like that, because that's not directly in relationship with the specific sport that we're doing, I would say. So, you know, I would probably prefer if you did more body rolls or more dancing and things like that. And it's just almost unnecessary high impact in the warm-up if you're going to get them to split, you know, do a dropping split or a flip later. Because we know, firstly, they're not going to tell you if they're leaking. Secondly, you might not know if they're pregnant or how many months postpartum. So you just don't want them to be in a position where they're feeling like they're going to leak or they feel really vulnerable in that position. And so I personally would take out high impact exercises in the warm-up and then adding in more pole-specific dance or dance-specific elements.
Yeah.
movements.
Yeah, our studio used to do a lot more high impact in the warm up, and certainly years ago I advocated against that. Basically, with this information going, there'll be a lot of women in class. In fact, effectively a third of women in class who are probably leaking at the moment during warm ups, and we're not aware of it, or you're not aware of it as an instructor, and it can cause issues ongoing. So, and like you said, there's no transference, there's no crossover from doing things like burpees, in a warm up to actually then there's no crossover to helping them improve their flips. So for those who you might be working with on impact style tricks, if they're experiencing incontinence, what would be your suggestion there, Jules? What would you?
Yeah. Well, firstly, if you are leaking, you probably should go see a pelvic floor physio, like I said. I would probably aim to get your pelvic floor functioning at an optimal function, so either stronger or being able to relax a little bit better before you go back to flipping, just because that constant pressure isn't going to help you with your pelvic floor rehab per se. And then, yeah, did I answer the question?
Yeah, no, perfectly. Like that's what I would say as well from my perspective is if you're trying to learn flips and tricks that are causing you to leak, and you're just basically putting repeated stress on an area that won't be able to recover whilst you're continuing to stress it. So women's health physio, pelvic floor physio is definitely your go-to in that situation. So for instructors out there, it's really helpful to have open conversations with your students. It's really helpful to have open conversations with your instructors. If you are leaking, you might want to pull your instructor to the side after class or prior to class and explain to them that you won't be doing X, Y, and Z in class because it isn't right for you. You don't have to go into all the details. You can just say, my physio said I'm not to do any impact exercise, or my doctor said that. And then you can, if you want to divulge the information, you can. But in the meantime, go get assistance, go get help, because there is grade A evidence. And if we talk about evidence tiers, not many of you will know this listening. Those of you who are in research will know this. There is grade A, the best of the best evidence that shows that pelvic floor physio is incredibly helpful when it comes to incontinence. So seeing help is definitely.
Yeah. And it's not to say that you can't flip ever. I think you just got to give your pelvic floor a little bit of time to get back up to scratch, and then you can start again, maybe start with low impact and then gradually build into high impact. And again, that's not like you can't do pole or any aerial arts either. So,
and I mean, we're talking about flips, right, which are pretty advanced things.
Yeah.
But, so like there'll be so many people out there listening to this that leak from like the smallest movements in like their warm up, and so we're using an extreme here to get across at a point. So please don't feel like it's only leakage will only occur for extreme heavy impact movements. May experience leaking with other movements, in which case it's the same thing. Please go and see your women's health or pelvic floor physiotherapist to get it looked at and get assistance. I spoke about this really briefly with Phoebes, but I guess it's probably worthwhile covering it again really briefly. A lot of people get put off to see a pelvic floor physio because of what they think will have to happen during the appointment. We laugh about it because like we are so desensitized. So we are completely a population that's just normal. Like I'd be happy to go see a women's health physio, pelvic floor physio, no problems. I just like whatever, this is fine. But there's a lot of people who, for many different reasons are not comfortable. And the reasons could vary from they have maybe never, been naked in front of another person, all the way through to like they may have experienced sexual trauma or abuse. So there's a range of different reasons. So we're certainly not laughing from that point of view. We're just so used to obviously talking about, examinations, but there are many different aspects to a pelvic floor examination, isn't there?
Yeah, for sure. And obviously it is the easiest for us to assess the muscle strength and coordination and endurance when we do an internal exam. But, we want to treat you as a whole person. So like Sim was saying, if you don't want any of that, of course we wouldn't do that. There are many things that we can try to assess how well your pelvic floor is functioning and what we can do to help that. And it might just be from assessing your abdomen. It could be from using an ultrasound to assess the muscles when you're contracting. It might just even be, external and touching the muscles and seeing how they're functioning. So we do have a couple more tools in our toolbox than the greatest tool, but I think it's important that you do even have a chat, because sometimes it just could be what you're doing in your life. If you change one thing, it could help the leaking, and you might not even need to do too much with your pelvic floor. So I think it's worth definitely seeing a pelvic floor physio.
Education's key, that's for sure. Okay, so we've chatted heaps about incontinence. Prolapse is very similar but very different, obviously completely different issue at hand, and prolapse is effectively one of the pelvic organs bulging through the pelvic floor. That's a fair definition of it, isn't it?
Yeah.
I'm sure that I'm still up to date with my definitions. And so this can be bladder, bowel, vaginal, or
cervix.
Cervix prolapse coming through, depending obviously on your anatomy and so forth. So at the end of the day, we won't go into this too much, but the idea, the concept in terms of treatment, it's fairly similar. It's to still go see your pelvic health physio, but the symptoms that you experience are probably different. Earlier. Yeah.
So I sort of briefly mentioned it before, but it is that sense of heaviness. Well, you can feel like a pressure or something pulling down from the vagina. It could present as a bulge. So, when you're wiping yourself, you can feel sort of something coming out of the vagina. Sometimes when things get a little bit worse, you might notice a difficulty emptying your bladder or your bowels. Like it's kind of like something stuck in there, but if you stand up hinge positions or you place your finger in to push it, more can come out. Why that's important, it's like I said before, the pelvic floor has a role in suspending these organs, and for some reason they're not functioning the way that we need them to be, and so there's this ligament or connective tissue laxity that's causing that movement.
Yeah, and then if you go and place further stress on it through pole dance, then that can further worsen the pelvic floor prolapse, and then that can lead to, and I mean, I don't want to be extremist here by any means, but like it can lead to consequences that then, if not addressed earlier on, can require surgery, and can cause significant quality of life issues. So so definitely addressing these issues earlier, you'll have a better outcome, that's for sure.
Yeah.
And the implications are fairly similar.
Yeah, I would say so, because it impacts whatever we're doing impacts the pelvic floor directly, which could either be weak or causing overactivity. Then if the pelvic floor muscles aren't functioning properly, then they're not able to perform their main role, which is supporting these organs. I just wanted to add as well, we've got a lot of students or people who are pole dancers, recreational pole dancers, that are postpartum population, that are high risk of having a prolapse post, that are postmenopausal as well. And so, I think it is, again, really important that we go back to the things that we talked about before, like decreasing the impact, making sure that your patients are breathing so that they're not saying worsening their pelvic floor, but creating this increase in pressure or changes to the pelvic floor that can affect their symptoms even more.
You're a physio first and pole instructor second, because you said patients, not students.
I can't switch brains that quickly.
I know, I love it though. It's so fine. It's so fine. But yeah, what you obviously meant was your students. So if your students,
yes. That's what I said.
I reckon many people have actually picked that up, but I was like, one sec.
I probably do it all the time in class as well.
I would do it all the time if I was instructing. So yeah, I don't think I could switch my physio brain off that easily. So I think from a pole instructor point of view, so making sure your students are breathing and avoiding or minimizing, avoiding for some people impact on capacity, but certainly for the higher levels, talking to your students and determining what's appropriate for them. There may be some students who impact is completely fine with, and it's about their pelvic health at the time. I want to talk about one more area which gets a few giggles. Look at that smile of yours just then. I want to talk about queefing, and you can't help but obviously smile when you say that word, because everyone wants to have a little bit of a giggle, but it is quite a serious thing, as I say when I'm like giggling. What is queefing?
Well, it's essentially a vaginal fart. We
Yeah.
say it
And that's
lightly.
why we giggle, right? Because it's just like, it's like someone farting in class. Like, it's like a giggle, you get over it. It's a normal human thing.
Yeah.
Talk to me more about why.
Yeah. So it can be loud or quiet, and it can be bothersome and not bothersome. So it often occurs when, I guess, if you think about the vagina as a canal, then when air enters and it comes out really quickly, that causes a fart. Okay. This can happen either from, again, the two things, the weakness or an increase in activity of the pelvic floor muscles. And so when there's weakness, then the air comes in easily and then it comes out easily. So that sound or that feeling of that you're getting. When it's overactive, it acts like a strong suction. It's almost like sucking it in really quickly, pulling the air in and then letting it out. So yes, again, it can happen when you're having pelvic floor issues.
Yeah. And it will be more so common with certain style movements. And I've definitely seen students report doing like little baby mini shoulder mounts on the floor, like little reverse sit-ups. That sort of style of movement kind of is more susceptible to queefing. Have you experienced anything like in terms of your students when you're instructing where they're more susceptible to queefing, like different positions, different tricks on pole?
I know that when your hips are over your head, if you think about, and then the pelvic floor is a little bit stressed, kind of like in your happy baby position, then that's just going to allow more space for air to come in. And so when you're rocking and then forwards, you're going to allow the air to come out. So you're more likely to get it when your knees or hips are above your hips. Yeah. So in your straddle sort of inverts, or what Sim was saying, when you're lying down and doing those those curls. Yeah.
Yeah, exactly. Yeah, cool. Awesome. I wasn't aware if there was any other positions that were more common, but yeah, that certainly lines up with what I know. And like you said, when your hips are up, it really stretches out that pelvic floor opening, so air is going to come in a lot quicker and then go out at a sudden pace. So treatment comes down to obviously seeing a pelvic floor physio. Obviously more susceptible if you have other issues going on at the time. So if you have leakage, prolapse, if you're postpartum, etc., all of those things, they're going to increase your susceptibility to experiencing queefing. So obviously addressing the main cause there is going to be the issue. But as we've also talked about today, an athletic or normal population may also experience these symptoms, and it's usually secondary to weakness or hyperactivity or lack of coordination that they're just not aware of at that point in time. Right. So we've covered so much. We've done a brilliant job today. Is there anything else that you would like to talk about that you would like, is there anything that you would really like to reiterate that you would love for the people of the pole and aerial community to know?
Yeah. Wow.
Just like hit me with the hard truths.
Wow.
Where do I begin?
You know what's really funny? I work in this every day, and it's just become such a norm for me that I forget that sometimes it's really scary when you're leaking, when you're doing something like pole, and you're not pregnant or postpartum. It's a lot. Or if you have any pain or any of those things that we talked about, any of those symptoms that we had earlier. But it's not something that you need to put up with. Like Sim said, there is grade A evidence for pelvic floor physios and pelvic floor exercises to improve particularly stress urinary incontinence. So go see somebody, go see your doctor, get appropriate referrals, see your MSc-Physio, tell them, find a pelvic floor physio. We can definitely treat that. I think a lot of people think just incontinence and then straight to surgery, but there's definitely the in-between. There's us.
There's a massive amount of in between that needs to occur.
Yeah.
And as a musk physio, it really bothers me how many people get sent straight to surgery from a musk point of view. But then I also hear the women's health side of things where people get sent to surgery and then they come and see me with hip problems after. And I'm just like, why did you end up in surgery? This was a very mild prolapse, or this was a very mild incontinence issue that could have 100% been addressed with pelvic floor physio, and they've never seen a pelvic floor physio in their life. So there is just so much that gets missed there. Can I add another pet peeve from a musk point of view here? But this might be a pet peeve of yours. You might also disagree with me completely. But those ads for incontinence pads drive me nuts.
Why?
because it's a lot of the time it's the wording on the ads where, so the pads themselves don't bother me. Like incontinence pads, nothing wrong with them. And then people with severe incontinence usually, or even moderate incontinence will utilize them. But it's like they don't promote pelvic floor physio. And I think that's what bothers me. It's kind of like, don't have to put up with it. Just use a pad for the rest of your life. So we are not about that. We are here if you need to utilize that for a certain period in your life. That's appropriate, but see a pelvic floor physio. Is that, do you share the same? Okay, good. I'll just move that on.
You know what? The other thing is, like you said before, it can be really scary to go see a pelvic floor physio, but kind of like with every other doctor, GP, musc physio, psychologist, you kind of need to shop for the one that suits you as well. And while they might be great and they might have the same title, they probably know exactly what I know and more. But if you don't relate to them on a personal level as well, it's okay. You can go see someone else. And I think part of treatment and education and all of these things comes from that relationship that you have with your therapist as well. So, just because one hasn't worked, it doesn't mean, the next one isn't. So it does take a little bit of shopping.
Yeah. Well, hopefully it doesn't. Hopefully it doesn't take much shopping at all. But like, if you have not found someone that is right for you, please go find someone else. Because, and I say this about the physio profession as a whole, is, if something hasn't worked for you, it doesn't mean that physio doesn't work. It just means that that one person wasn't the right fit for you. So it doesn't mean that you just stop the whole process and do nothing and sit back and let things get worse. You take an active approach in your own rehab. I think everyone at home knows that too. So. Right. Well, I've had a great last hour or so, probably not quite an hour, but ish with you. No, it's perfect. This was great. This was everything that I wanted from today's chat with you. So thank you so much for sharing what's only like a very small amount of that knowledge in your brain up in there. Like there is so much that I know that goes on in there. So I'm very appreciative, and I'm sure everyone at home is as well. Before we say goodbye to you, I wanted to do a little bit of a mini special announcement, because we kind of have some details figured out, but maybe not all of them. And the announcement is that Julia will be joining us later this year to present either a workshop or a course. We're still, like I said, figuring out the details, where we will be discussing pregnancy and pole, and it will be aimed at anyone who's pregnant, but most importantly to instructors. So there's been a big call within the pole community over the last year where for information about how to teach pregnant students. So it will be not necessarily about like every particular move and bits and pieces like that. It will be more about trying to figure out the basic principles and understandings of what's appropriate and how you go about teaching certain things in relation to pregnancy. Is that a good description of it, Julia? Did I do okay there? Yeah.
Would it simply just make you feel more comfortable with teaching somebody who's pregnant or teaching somebody who's just come back, after their physio's cleared them?
Exactly. Yeah. So we'll be talking through all of that. For anyone at home who is themselves, they're pregnant or they're postnatal and they are wanting to get back into pole, or like I said, they're pregnant and wanting to stay poling throughout, but wanting to do that in a safe manner, that they're not worried about weird, horrible things happening. I'm not doing a very good job of explaining things today, am I? Basically what I'm trying to get at is that we have created a course already for you, and it's through the incredible team at Pole Physio at Pole Society. So I have linked that in the email, and you can check that out. And it is basically a designated course for you to keep you polling safely throughout pregnancy. But yes, we will look forward to bringing something later this year for instructors to make sure that you feel safe and comfortable teaching pregnant students. All right, I'm going to stop talking because clearly I'm word vomiting. We're going to leave it there. Thank you once again, Julia, for your amazing contribution to the summer series. We appreciate you. You have a lovely rest of your day, and thank you to everyone at home for joining us. And one sec, we're going to do a quick cheers, actually. Cheers to finish off.
Cheers. Cheers. Oh, wait. Okay.
And then your pelvic floor cheers. Cool. Love it. All right, thanks everyone. Have a lovely rest of your day, and we'll see you at the next summer series.
Bye. Thanks, Em. Bye.